is Colon Cancer Awareness Month, a time to educate people about the importance of routine screening. With more than 100,000 new cases each year, colon cancer continues to be a concern. And joining us to talk about the risk factors and prevention is Dr. Maram Zakko, Gastroenterologist with Palomar Health. Welcome.
Thank you for having me.
Doctor, the American Cancer Society reports an estimated 153,000 cases of colorectal cancer will be diagnosed this year. Can you tell us some of the first signs and symptoms to be aware of?
Some rectal bleeding, change in bowel habits, small stool caliber. However, you should not have these symptoms. If you screen properly according to the national recommendations, the colonoscopy will resolve all these precancerous lesions without symptoms. Once you have symptoms, it's late. Only 1 out of 4 patients with colon cancer have family history.
Now, the good news is colon cancer is also highly preventable, and there are a number of risk factors that individuals can address right now.
That's true. The risk factors for colon cancer that can be corrected are obesity, diabetes, smoking, excessive drinking, consumption of processed meat, and sedentary lifestyle. Right now, starting today, after this interview, to exercise, vegetables, high fiber diet.
Now, a new report warns about a troubling rise in colon cancer among younger ages. Tell us about that.
Yeah, in fact, recently it's been noticed that there's a trend towards increased rate of colon cancer in patients between 40 and 50 years. That's why the national standard now is starting screening at 45 instead of 50. And we screen African Americans and Native Americans at 40 because they do have higher risk for colon cancer than the average population.
And routine cancer screening remains a powerful tool.
In fact, screening for colon cancer is very effective. It prevents almost all colon cancers if you do it right. Colonoscopy is the gold standard, and it catches precancerous conditions much earlier than other modalities. And colonoscopy is an easy test. Other modalities are stool testing for blood on a yearly basis, or stool testing for blood and DNA of the stool every 3 years, or a special CT scan called CT colonography every 5 years.
And the hopeful news is that colon cancer is treatable, especially when caught early.
When caught early, most of the time it's curable. If caught advanced, new technology and new treatments can get the patient to live many, many years compared to previous.
Now, when is it time to see a gastroenterologist, and what does the patient's first appointment look like?
Well, basically, any patient who sees any alarming signs should go to his doctor or gastroenterologist. And really, the first appointment is very casual. Some questions about medications, health issues, heart, lung, if you take any blood thinning medications, all these so to adjust the procedure and make it a safe one.
Now, what are some common questions you get asked that you feel more people need to know about?
Most of the patients, they love to sleep during the colonoscopy. This procedure is not painful at all because people get anesthesia. They want to do it again very soon because they said, I had the best sleep of my life.
Talk to your doctor about options for early detection and prevention. For more information, visit palomarhealth.org. Dr. Zakko, we thank you so much for sharing this valuable and life-saving information.
Thank you so much for having me here.
And we thank you for joining us on San Diego Living. We'll see you next time.